Welcome back to Health Revival, the place where we work together to find ways to live healthier, live longer, and stay mentally sharp every single day. There is a harsh truth that very few doctors have enough time to clearly explain during a short medical appointment. After the age of 70, the human body no longer functions the way it did in your 40s or 50s. At this stage, your kidneys filter waste more slowly, your liver metabolizes compounds at only a fraction of the rate it once did, and your brain becomes extremely sensitive to sedative medications. A dose that was once considered safe in middle age can now become a direct cause of dangerous falls, serious cognitive decline, or even permanent kidney damage problems we often mistakenly assume are simply part of aging. In today's special video, we're going to listen to important insights from Dr. Clarence Martin about 5 medications he says he would never allow his own mother to take after the age of 70. And here's the most concerning part. 3 of these 5 medications can be easily purchased at any pharmacy without a prescription. That convenience is exactly what makes them so dangerous, because we stop treating them like real medications and start treating them like harmless candy. From sleeping pills and common pain relievers to even stomach medications that millions of people take every day, all of them appear on warning lists from the American Geriatrics Society. Are you or your loved ones unknowingly putting your health at risk with these medications? Let's explore the truth and discover safer alternatives together, right here on Health Revival. Why do medications become more dangerous after the age of 70? After the age of 70, our bodies no longer process medications the same way they did when we were younger. This is something that very few people have clearly explained to them, but it is extremely important. As we age, the kidneys filter medications more slowly, which means drugs stay in the bloodstream longer. The liver also metabolizes medications more slowly, causing drugs to accumulate in the body, instead of being cleared efficiently like before. In addition, the brain becomes more sensitive to sedatives, sleeping pills, and antihistamines, making older adults more likely to experience dizziness, confusion, or balance problems. This leads to a very dangerous reality. A dose that was completely safe at age 50 can cause falls, kidney damage, confusion, or memory problems at age 70. Many cases of memory decline in older adults are actually related to medications, not Alzheimer's disease. Geriatric doctors often use a list called the Beers criteria, developed by the American Geriatrics Society. This list identifies medications that are considered high risk for older adults and should be avoided or used with great caution. Therefore, after the age of 70, the most important thing is not necessarily taking fewer medications, but taking the right medications that match a body that has changed with age. 5 medications people over 70 should avoid. 1. Sedatives, benzodiazepines. The first group of medications that many geriatric doctors are very cautious about prescribing to older adults is benzodiazepines, a class of drugs commonly used to treat anxiety, stress, insomnia, or panic attacks. Many people may not recognize the drug class name, but they are very familiar with brand names such as Xanax, Valium, Ativan, and Klonopin. These medications calm the nervous system and help people fall asleep faster, which is why they are widely used, especially among older adults who struggle with insomnia or anxiety. The problem is that these medications are relatively safe for younger adults, but they become much more dangerous as the body ages. After the age of 70, the liver metabolizes drugs more slowly and the kidneys eliminate drugs more slowly, which means the medication stays in the body much longer than before. This means a pill taken at night to help with sleep may still be active at 3 or 4 a.m. when an older adult wakes up to use the bathroom. At that time, reaction time is slower, balance is worse, and the risk of falling becomes much higher. This is why benzodiazepines significantly increase the risk of falls and fractures in older adults. And for someone over 70, a fall is not just a minor injury. It can lead to a hip fracture, hospitalization, loss of independence, and many older adults never fully regain their mobility after a serious fall. Benzodiazepines also directly affect the brain. Many studies have shown that this class of drugs can cause memory problems, difficulty concentrating, confusion, slower reaction time, a foggy feeling in the brain, increased risk of dementia with long-term use. Another serious issue is drug dependence. When benzodiazepines are used for a long time, the body becomes dependent on them. People may feel they cannot sleep without the medication, their anxiety worsens without it, and over time, they may need higher doses. If the medication is stopped suddenly, it can cause tremors, severe insomnia, intense anxiety, and even seizures. That is why these medications should never be stopped abruptly and must be tapered slowly under a doctor's supervision. It is important to understand that benzodiazepines are not always bad. In some short-term situations, they can be very helpful. However, for people over 70, especially if taken daily for sleep or anxiety, the risks often outweigh the benefits. That is why many geriatric doctors try to reduce the dose, gradually discontinue the medication, or replace it with safer alternatives, such as cognitive behavioral therapy for insomnia, meditation, breathing exercises, or other medications that have less impact on balance and memory. The most important thing is that older adults should review any sedative medications they are taking, especially if they have been using them for many years. 2. Diphenhydramine Benadryl, an allergy medicine, commonly used as a sleeping pill. One of the most common medications many older adults take every night for sleep is not actually a prescription sleeping pill, but an allergy medication called diphenhydramine, commonly sold under the brand name Benadryl. This ingredient is also found in many over-the-counter sleep aids such as Zizquil, Unisom, and Tylenol PM. Because these medications can be easily purchased at a pharmacy without a prescription, many people assume they are completely safe to take every day. However, for people over the age of 70, this is actually one of the medications geriatric doctors often recommend avoiding. Diphenhydramine belongs to a group of medications called anticholinergic drugs, which means it blocks the activity of acetylcholine, a neurotransmitter in the brain. Acetylcholine is extremely important for memory, learning, and clear thinking. Taking this medication occasionally for allergies is usually fine, but if someone takes it every night for months or years as a sleep aid, it can significantly affect brain function. In older adults, this medication can cause many side effects, such as confusion and memory problems, daytime drowsiness, dizziness, dry, mouth constipation, urinary retention, poor balance, increased risk of falls. Many families assume that when older adults become forgetful, it is simply due to aging or Alzheimer's disease. However, in some cases, the cause is actually anticholinergic medications like diphenhydramine. A large study that followed more than 3,000 adults over the age of 65 for several years found that people who used higher amounts of anticholinergic medications had a 54% higher risk of developing dementia compared to non-users. Importantly, the risk increased with the total amount of medication used over time, meaning the longer someone used these medications, the higher the risk. Because of these risks, diphenhydramine is included in the Beers criteria, a guideline published by the American Geriatrics Society that lists medications considered high risk or potentially inappropriate for older adults. The concerning part is that many older adults take Benadryl every night for sleep, for years without realizing that it may be affecting their memory and brain function. The medication may help you fall asleep faster, but the long-term cost could be worsening memory, brain fog, and an increased risk of dementia. Therefore, if someone over 70 is using diphenhydramine every night for sleep, the most important step is not to stop it abruptly on their own, but to talk with a doctor about safer sleep alternatives. Sleep is very important, but protecting the brain is even more important. 3. NSAID pain relievers, a silent risk for people over 70. The next group of medications is very familiar in almost every household. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. The two most common ones are ibuprofen, Advil, Motrin, and naproxen, Aleve. Many older adults use these medications for back pain, knee pain, shoulder pain, or arthritis. For younger people, occasional use usually does not cause major problems. However, for people over the age of 70, frequent or daily use can lead to serious health issues that many people do not realize. The biggest problem with NSAIDs in older adults is their effect on the kidneys. The kidneys are responsible for filtering medications out of the bloodstream, but after the age of 70, kidney function is often significantly reduced compared to younger years. When taking ibuprofen or naproxen, the drugs stay in the body longer, reduce blood flow to the kidneys, and over time can damage kidney tissue. The dangerous part is that kidney damage from NSAIDs often happens silently, without clear symptoms until kidney function has already declined significantly. The second major risk is gastrointestinal bleeding. As we age, the lining of the stomach becomes thinner and more fragile. NSAIDs reduce the protective layer of the stomach, allowing stomach acid to damage the lining more easily. This can lead to stomach ulcers or internal bleeding. According to many medical studies, older adults who use NSAIDs have a 3 to 5 times higher risk of gastrointestinal bleeding compared to younger adults. And when older adults experience internal bleeding, the condition is usually more serious, often requiring hospitalization and a longer recovery time. In addition, NSAIDs can increase blood pressure and cause fluid retention, which raises the risk of heart failure, especially in people who already have heart disease or high blood pressure. Many older adults take pain relievers every day for joint pain without realizing that the medication may be making their blood pressure harder to control. What is concerning is that many people consider NSAIDs to be very normal and harmless because they can be purchased over the counter without a prescription. But in reality, for people over 70, regular NSAID use is much more dangerous than most people think. This is also why this group of medications is listed as needing caution in the Beers criteria from the American Geriatrics Society. And this does not mean older adults can never take ibuprofen or naproxen. In some situations, short-term use may still be acceptable if recommended by a doctor. However, the important thing is not to turn NSAIDs into a daily medication for chronic joint pain. Many doctors recommend that for older adults who need frequent pain relief, paracetamol acetaminophen is often a safer option for the kidneys and stomach when taken at the correct dose. In addition, methods such as gentle exercise, physical therapy, weight loss, heat therapy, and lifestyle changes can also help reduce joint pain without relying on strong pain medications. 4. Zolpidem, Ambien, helps you sleep faster but carries high risks for older adults. Another very common sleeping medication, especially among older adults with insomnia, is Zolpidem, commonly known by the brand name Ambien. This medication is widely prescribed because it helps people fall asleep faster and makes them feel like they are sleeping better. However, for people over the age of 70, this drug carries several risks that many people are never clearly told about. The biggest issue with Zolpidem is that the medication does not fully wear off by the next morning in older adults. Because the body metabolizes the drug more slowly, many people still have the drug in their system when they wake up, but they don't realize it. They may feel fully awake, but in reality their reaction time is slower, coordination is worse, and their balance is reduced. This significantly increases the risk of falls, especially when older adults wake up during the night to use the bathroom or walk around early in the morning. And for older adults, a fall is not a minor issue. One of the most serious consequences is a hip fracture, which is a very dangerous injury in older adults. Statistics show that people over 70 who suffer a hip fracture have a 20 to 30% mortality rate within 1 year, often due to complications such as pneumonia, blood clots, or long-term loss of mobility. Zolpidem also has another problem that many people do not know. It does not produce completely natural sleep. The medication helps you fall asleep faster, but it reduces deep sleep, which is the most important stage of sleep for physical and brain recovery. This means you may fall asleep quickly and sleep enough hours, but when you wake up you still feel tired, not refreshed, and mentally foggy. Because of this, many people think they still have insomnia and start increasing the dose. This creates a cycle. Trouble sleeping leads to take medication. Sleep, but not deeply, leads to still tired. Think the dose is not enough leads to increased dose. Body becomes dependent on the medication. Cannot sleep without the medication. After some time, people become dependent on sleeping pills while their sleep quality does not actually improve. For these reasons, many doctors now recommend that for older adults, instead of long-term use of sleeping pills like Zolpidem, cognitive behavioral therapy for insomnia, CBTI, improving sleep habits, reducing daytime naps, light exercise, and adjusting evening light exposure are often more effective in the long term and much safer. The most important thing to remember is that sleeping pills do not solve the cause of insomnia. They simply make you unconscious faster. And for people over 70, the price of falling asleep quickly can sometimes be a higher risk of falls, fractures, and overall health decline. 5. PPI stomach medications. Omeprazole, Nexium. Dangerous when used for too long. The last group of medications on this list often surprises many people, because these are among the most commonly prescribed medications in the world. Acid-reducing stomach medications known as PPIs, proton pump inhibitors. Common examples include omeprazole, Nexium, and Prilosec. These medications are very effective for treating acid reflux and stomach ulcers and are usually prescribed for a short period of about 4 to 8 weeks. The problem is that many people do not take these medications for a few weeks, but for many years, sometimes even decades, even though their stomach condition has long since healed. When used long-term, these medications can quietly cause health problems that many people never realize. One of the biggest issues is vitamin B12 deficiency. Stomach acid is not only needed for digestion, but also helps the body absorb vitamin B12 from food. When someone takes PPI medications for a long time, stomach acid is significantly reduced, which prevents the body from properly absorbing vitamin B12. Vitamin B12 deficiency in older adults can cause numbness in the hands and feet, loss of sensation in the feet, difficulty walking or poor balance, fatigue, confusion, memory problems, symptoms that look similar to dementia. Many people think they have Alzheimer's disease, but in reality, it may simply be vitamin B12 deficiency caused by long-term use of stomach acid medications. The second issue is magnesium deficiency. The health authorities have warned that long-term use of PPIs can lead to low magnesium levels in the blood. Magnesium is very important for heart function and the nervous system. When magnesium levels are low, people may experience irregular heartbeat, muscle cramps, fatigue, dizziness, seizures in severe cases. In addition, some studies suggest that long-term PPI use may be associated with cognitive decline and an increased risk of dementia, although this relationship is still being studied. However, one thing is certain: taking stomach acid medication for many years without reassessing the need for it is not recommended, especially in older adults. The concerning part is that many people start taking omeprazole for stomach pain or acid reflux, and then they continue taking it every day for many years without anyone checking whether they still need it. Meanwhile, many cases of acid reflux can actually be managed with lifestyle changes, such as eating earlier in the evening, losing weight, avoiding lying down immediately after eating, reducing coffee and alcohol, elevating the head of the bed, using milder medication only when needed. Therefore, if someone over the age of 70 has been taking PPI medications like omeprazole or Nexium for more than 6 months or several years, it is very important to ask a doctor, do I still need this medication? Should I check my vitamin B12 levels? Can I reduce the dose or gradually stop the medication? Sometimes, simply reviewing the medication list once can help remove a medication that has been taken for years unnecessarily, and that alone can significantly improve memory, nerve function, and overall health. What should you do after watching this video? After learning that many common medications can become dangerous as the body ages, the most important thing is not to panic and stop medications immediately, but to review all medications in a careful and safe way. Geriatric doctors often recommend that older adults do the following 5 important things. First, write down every medication you are currently taking. This includes prescription medications, over-the-counter drugs, sleeping pills, allergy medications, pain relievers, stomach medications, vitamins, and supplements. Many people only tell their doctor about prescription medications and forget about over-the-counter drugs like sleep aids, allergy pills, or ibuprofen, even though these are sometimes the medications that cause the biggest problems. Second, bring that medication list to your doctor for a full review. In medicine, this is called a medication review, which means reviewing all medications to determine which ones are still necessary, which ones should be reduced, and which ones should be replaced with safer alternatives. When you see your doctor, you can ask specifically about the Beers criteria, a list of medications considered high risk for older adults developed by the American Geriatrics Society. Many doctors use this list to adjust medications for older patients in order to reduce the risk of falls, confusion, kidney problems, and other complications. Third, if you have joint pain or back pain and are taking ibuprofen or naproxen regularly, ask your doctor whether paracetamol, acetaminophen, may be a safer option, since it is generally safer for the kidneys and stomach when used at the correct dose in older adults. Fourth, if you suffer from insomnia and rely on sleeping pills, ask your doctor about CBTI, cognitive behavioral therapy for insomnia. This is a non-drug treatment for insomnia, and many studies show that it works better than sleeping pills in the long term and does not cause dependence. Fifth, if you have been taking stomach medications such as omeprazole or Nexium for a long time, ask your doctor whether you should check your vitamin B12 and magnesium levels, and whether you still need to take the medication every day. And the most important thing to remember is this: never stop any medication on your own, especially sleeping pills, sedatives, heart medications, or blood pressure medications. Any medication change should be done under a doctor's supervision to avoid dangerous complications. Sometimes, simply adjusting a few medications can significantly improve memory, mobility, sleep, and overall quality of life in older adults. Growing older is not always what causes health to decline quickly. In many cases, what truly causes health to worsen is not a new disease, but old habits and old medications that have been continued for too long while the body has already changed. Some medications may have helped you sleep better, reduce pain, or control acid reflux many years ago. But after the age of 70, the body no longer processes medications the same way. The kidneys are slower, the liver is slower, and the brain is more sensitive. Sometimes, the very medications people have taken for years become the hidden cause of falls, confusion, fatigue, numbness, or memory decline without anyone realizing the real reason. The most important takeaway from this video is not that you memorize the names of these medications, but that you start reviewing all the medications you are currently taking. Sometimes, just one medication review with a doctor can remove a medication that is no longer necessary, reduce a dose that is too high, or replace a drug with a safer alternative. And sometimes, just one small change like that can significantly improve memory, walking ability, sleep, and overall quality of life. Health Revival believes that taking care of your health is not always about taking more medications, but often about taking fewer medications, the right ones, at the right time. If you found this video helpful, please share it with your parents, grandparents, or loved ones. Sometimes a small video can help someone avoid a fall, a hospital stay, or a serious health problem in the future. Health Revival will see you again in the next video.